And back now with Sunday House Call. You know, May is National Arthritis Awareness Month. It's a common joint disorder with symptoms such as pain and stiffness. And if you got it, you know what I'm talking about. So, Dr. Siegel, if you do suffer from arthritis, what do you do?
Well, the first thing you do is you should understand what it is. We all have joints. Take a knee joint. The knee is covered with cartilage. In between the cartilage is fluid. If the cartilage starts to wear down, that's osteoarthritis. That's the #1 cause of disability, by the way, in the United States for people over the age of 55. It's huge. And you know why your cartilage is wearing down? You weigh too much. You're inactive. You're not going to physical therapy if you need it. You're not exercising regularly. We're both big fans of exercise. Lose the weight. That's the #1 treatment, because most Americans are taking non-steroidals like Advil, like Aleve, like aspirin, like Celebrex. And you know what that does? You take that every day.
Jacks up your liver, your kidney,
bad
right?
for your liver and your kidneys, doctor. That's exactly right, Arthel. So that's my biggest problem. Now, the second kind of arthritis is in the fluid in between. I talked about the knee. That's called the synovial fluid. That gets inflamed because your body is attacking itself. It's called autoimmune. David will talk about this, but we've had a revolution now in treatments, and we can dial it back by giving something called biologics, which are very powerful immune agents that if you're suffering from rheumatoid arthritis, I'm sure you've heard of these drugs. They help people, and they make the disability much better.
Is that a pill, a biologic?
They have it intravenous and by pill now.
Is that different from the injections in your knee?
Well,
two different.
No, that's steroids. Those are steroid injections.
Oh.
This is something that pushes back the immune system, which is causing you to have the rheumatoid arthritis. They started off as injections, and now we can take them orally.
Dr. Samadi.
I think it's important for people to understand these two diseases. There are hundreds of different types of arthritis: reactive arthritis, osteoarthritis, rheumatoid arthritis, and there are blood tests that we can get to look for those rheumatoid factors to find out which types you have. But for people that are watching the program, if you look at your fingers, rheumatoid arthritis basically affects both sides. It's a symmetrical disease. Both fingers are curved, both joints are curved. You wake up in the morning, you have pain. As time goes on, it gets better as you become active. And it affects your entire system because it's autoimmune. It affects your eyes, kidneys, heart, like just what we spoke about. Osteoarthritis is a degenerative disease. As we get older, the cartilage wears off, so you have bone against bone. Your knees, your pelvic bone, your hips, those are asymmetric, meaning that it would be your right hip that's causing, and that's where surgery plays a big role, because we can remove or put a new joint. We can do a lot of surgical events. For rheumatoid arthritis, we're giving a lot of anti-immune drugs. You talk about DMRADs. These are methotrexate, things that will lower your immune.
DMRADs is what?
DMRADs are the type of medications that can modify your immune system.
That includes those biologics.
Okay. Exactly. Wow. So that's right. So
you should ask your doctor for DMRAD? Maybe?
No.
Well, no.
You go in and you say, Doc, I have a lot of pain.
Okay.
I heard Dr. Samadi said, look at my fingers. Do I have arthritis or not? Don't ask for DMRADs because you get the Greek yogurt instead. Let him do the test.
One thing I want to clear up here is we're talking about two different kinds of arthritis, and David was just explaining and I was explaining. One is the wear and tear type. Yep. The other is the inflammation type. But the one that's more common by far is that wear and tear. Think of your cartilage as a shock absorber. You know what? You're wearing out your shocks when you weigh too much.
So
when you pound on those things. I mean, you weigh 100 pounds too much and you're running on pavement, you're going to cause a problem. As David said, they tend to favor one side or another. You don't necessarily have it in both hips. Right. But before you go to surgery, because he was talking about surgery, which is obviously an option eventually, before you go to surgery, you got to lose the weight and do physical therapy.
Why don't all doctors say that?
No, but they do. And this is very important.
I love that you say that.
Swimming, low weight exercises, especially swimming and yoga, and some of these exercises are key to do this.
How about the treadmill? Just walking. I see people.
Well, you gotta be careful because you're going to get the.
I like low impact, like the elliptical, the bike.
Absolutely. Physical therapy.
Yeah, every day.
That's why his knee has osteoarthritis.
It does after this bike ride, I'm telling you.
One of these days, as a urologist, I'm going to take the knee out.
We'll do that live.
You stick to your field.
I know. See,
Okay.